There are mental health benefits, physical health benefits, and social connection benefits when humans and animals interact.
Yeah, and if you've ever had an animal, you certainly know that to be true. Whether it's a dog, a cat, or something else, the positive impacts of owning a pet are endless. In fact, research found that people with pets often report being happier, less stressed than those who don't have a pet. Sadly, not everyone who wants an animal is in a situation to be able to adopt one. But there may be a solution thanks to a futuristic technology sitting on my lap and brought to us by our lovely guest today. Joining me now to talk more about these robotic pet programs is Becky Fehlig, a nurse manager at UCHealth. Becky, thanks for joining us. Initially, when I walked over here and saw you, I didn't know what to expect. I knew what the segment was, but I hadn't seen. So this is a cat that sort of feels like a cat and acts like a cat, but it's robotic. Why is this important?
So at UCHealth, we're always looking to improve lives, and on our ACE unit, we see a lot of dementia patients. When they're in the hospital, they can become agitated, high anxiety, loneliness, and a lot of them have pets at home that they miss, or maybe they've had pets in the past. And so bringing them this companion that seems like a very real cat or a dog, and we also have birds, has been just like totally amazing. And yeah.
So you have dogs, cats, birds.
We do.
I think the incredible part about this is if you've ever dealt with anybody who has dementia, they can easily forget that they have to feed an animal or whatever. And this, do you find, because the benefits, I have a dog, you said you love dogs, anybody who has a cat, you can feel your heart rate slow.
Yes.
You can feel happier. You can feel like there's something moving in your house when you live alone. Do you see them get those benefits even from a mechanical robotic pet?
Absolutely. We've brought them in when a patient has been agitated of this isn't my home, I want to go home, and it's a very unfamiliar environment for them, unfamiliar faces. And then we bring in something like a cat or a dog, and they immediately de-escalate. They want to sit down, they want to care for the cat, they want to care for the dog. And so you can see their demeanor just completely change.
When you first heard about this program, what was your first thought?
When it was first brought to me by our CNO, I was like, well, let me see what the research out there shows. And these have been in nursing homes for a while. There's not a lot of research shown for inpatient settings, but I was like, let's give it a try. So we got a few in, and the very first patient that we brought it in, I was like, let's see what happens. And
was it immediate?
It was immediate. Immediate response from her. Her demeanor changed. She was like, this is mine, this is my cat, and she loved it. She gave it a name.
I was going to say, do the patients interact with the robotic animals like we do? Do they name them? Do they care for them?
Yes, they name them. Some of them think that it's real. Some of them know it's a robot, but it doesn't matter to them. It's their pet.
The benefits are the same. What are you hoping? Yeah, this one. Sorry, what's a belly rub? What are you hoping to get out of this program in the future?
Yeah, I mean, obviously we just want the best outcomes for our patients at UCHealth, and of course our elderly population that are so vulnerable, and with our patients with dementia. So having those positive outcomes of whether it be lower length of stay, they're leaving without having a fall with injury, they're leaving without increased medications to calm them down. So this is really at the nurse's fingertips to use as an intervention for these patients that, previously we've been using medications or anything like that. So it's been amazing.
It is amazing. And it's almost real-like. It sheds a little bit. So I'll give her back to you. I'm not sure. Did you name this one?
This one's name is, we can call him Charlie.
Oh, Charlie.
Yeah,
all right. Well, thank you and Charlie for coming in. It's an amazing program, and anything that can help folks who need the help is wonderful.
Thank you.
Even a robotic cat.
Thank you for having us.
All right, Becky, thanks. We'll be right back.